I'm Sylvia Gordon.
And I'm Rebecca Gordon.
We have a very nerdy topic to talk about for those of you that really like to know how the sausage is made, what's going on with the NAIC, National Association of Insurance Commissioners. So we have their 2022 report that just came out. But before we talk about the NAIC, talk about the relationship between CMS and the NAIC.
Yeah. Yeah, go ahead.
Go ahead.
You're doing great.
So CMS is the feds. So before we had Obamacare and MedAdvantage, so let's go back to 2002.
Everything was at the state.
Everything's at the state level. There is no federal Department of Insurance. That's something every election somebody puts forth. But insurance is at the state level, and all 50 state insurance commissioners do their own
They
thing.
had state pools.
They all do
had-
it different.
Right.
They do it different. So once we got Medicare Advantage and Part D and then Obamacare at the federal level, they're in charge of that. And that confuses especially new agents because MedSup's here, MedAdvantage here.
Mhm.
That's why you need a scope for MedAdvantage. You don't need a scope for MedSup. That's why you can't cold call for MedAdvantage. You can cold call for dental, vision, hospital, and dental, blah, blah, blah. So it's really confusing, especially to new agents. So we wanted to tell you a little bit about what the NAIC reported.
So we have roughly 6,000 insurers in the country. That's a lot.
6,000 different insurance companies. I thought that was a big number.
Yeah, I think.
Especially since most of us sell for like 10 to 20.
Right.
But that's including property and casualty, title insurance, health, group, life, annuities, all together.
So the revenues collected increased by about 10%.
So the business is strong. It's growing.
Fascinating. And state insurance departments received roughly 300,000 official complaints.
Which I don't think that's that bad.
I don't know. Out of 1.5 million, doesn't seem bad. We should have done the percentage.
In terms of state with the most premium, it is going to be California and New York. But this is what type of insurance is being written in the country.
Right.
So you can see 42% of it is health.
I think it's really interesting. 30% is life and annuities. That's awesome. That's
Bigger than I expected.
that is way bigger.
Yeah, property and casualty I figured would be much, much, much
Which
bigger.
kind of says if you're in the health market and you're not in this market, you're missing it. That this is a big buy.
Right.
That is very
Because-
surprising.
Because that's a natural corollary
Huh.
to health. This
Cool.
is all life and annuities. So if you have questions and you're always like, well, why is this not happening? Why? There's really not a lot of cooperation between CMS and the state.
Yeah.
So you'll have an agent that, I'll think of one in particular, that got accused of forgery and got terminated from his Medicare Advantage company. Just one Medadvantage company. State didn't do anything to him.
Right. None of the
This
other
Advantage
carriers-
company didn't tell the other Advantage companies, so he's still writing everything except for the one that he got terminated from.
Mhm.
Doesn't make sense.
Right.
And they say, well, we reported to the state. I don't think. Yeah, there's not that integration that you might think exists. It's very much two separate
And
systems.
a lot of people have suggested that we should have a department, like you said, of insurance at the federal level.
And that's something that's kicked around every election. So let's see what happens this year.
Yay.
Thanks for watching.
See ya.